Good afternoon. I want to pick up where we left off around the fact we've stood down Gold Command, but I want to try and get across very strongly the fact that the immediate crisis response has been dealt with, and I would like to thank everybody for their effort and commitment in ensuring that we responded appropriately there. We're now probably going into a much more difficult and protracted period where we're going to have to redesign and reconfigure many of our services. We're going to have to live with the fact that COVID will be with us for a very long time, and that's going to put massive pressure on services, especially the design and the configuration of them. The reality is, to be frank, we'll need a lot more physical space in outpatients, theatres, wards, health centres, treatment rooms than we've ever had before. It's simply not possible just to do more of the same, and therefore we're going to have to be innovative in how we address this challenge. We are looking for services to come forward, and we've put a framework in place to enable them to do so, to look at how they can optimise the use of digital technology. Many of you have been doing so with the use of Near Me, and we're really keen to see that expand. Secondly, we do want to make sure we optimise things that make us more efficient, such as the use of texting for appointments to make sure we don't have a significant number of DNAs. And the other thing we do want to push hard, and we've got good examples of it coming forward, is around family or self-care of individuals. We need to accept now that we need to try and keep people away from hospital if there's an alternative way of doing so. The final point I would make is we will make more changes to our services than we have done for a long time in a very short space of time. We have therefore committed to having a system librarian in place to coordinate all clinical guidelines, make sure they're up to date and at a central point for all staff across NHS Lanarkshire. That central repository will be the central point I want everybody to use, and there'll be more information about that shared in a daily bulletin in the weeks and months ahead. Many thanks.